The UK's already seen its government come under severe criticism from both its citizens and other European nations for its handling of the COVID-19 virus. With shop shelves empty and people queuing for food, as well as France potentially imposing a ban on Brits travelling to mainland Europe, the NHS woes should be the last of the worries on Boris Johnson's mind. However, this is clearly not the case. With a hugely under-resourced and quite frankly exhausted NHS system, the UK are now turning to desperate measures in order to fill the personnel gaps left in the service in a post-Brexit era. 65,000 retired NHS staff have been written to, begging them to come out of retirement and onto the front line of the COVID-19 war.
For the NHS, the ability to test their staff, our staff, I'm an NHS worker myself, when people are actually unwell and self-isolating, particularly if they've got mild symptoms that mean that they could normally go back to work, is absolutely critical.
The UK currently has a massive shortage of doctors and nurses, partly because many have abandoned the UK and returned to Europe following Brexit, and partly due to huge underfunding in the NHS, which has seen many staff line the pickets in protest. The UK currently has the second worst doctor per citizen rate in Europe.
Across the United Kingdom, at least 6% of the NHS workforce are EU nationals. It's much higher in London. 15% of the NHS workforce in London are EU nationals. They're vital members of our teams. They're nurses and doctors and clerical staff and really important parts of how we care for our sick people and in our communities.
With the shortage of doctors and nurses comes more pressure on the NHS, especially when the Prime Minister is suggesting that staff in the NHS still come to work in order to avoid a lack of numbers.
The objective is to slow the spread of the virus, and as I say, we judge that this is the right moment to do that. But of course, as I've always said, we also need to keep the NHS going and to treat the rising number of cases. So we need health workers who are also parents to continue to go to work, and we need other critical workers with children to keep doing their jobs too.
No wonder then that the French are proposing blocking the border with the UK as the whole continent goes into lockdown, whilst the UK insists people still go to work. But warning of the NHS's failure is nothing new, with 1,000 GPs warning just last year that the NHS is on its knees and that action must be taken sooner rather than later in order to avoid a total collapse of the National Health Service.